Hi, I'm Dr. Sharbul Hashul, and today let's talk about triple negative breast cancer, a term that sounds scary, but once you understand what it actually means, it becomes a lot less mysterious. First, let's clear up the name because it confuses a lot of people. Triple negative doesn't mean the cancer is more dangerous just because of its name or that there's nothing to test for. It actually refers to three specific things that are absent when doctors look at the cancer cells under a microscope. Normally, when a pathologist examines a breast cancer sample, they check for three markers: estrogen receptors, progesterone receptors, and something called HER2, which is a protein that can help some cancers grow. If a cancer has any of these three, doctors have targeted treatments that work specifically against them, things like hormone blocking pills or HER2 targeted therapies. Triple negative simply means all three of these markers are negative. The cancer isn't fueled by estrogen or progesterone, and it doesn't have extra HER2 protein driving it. So why does this matter? Because those three markers are exactly what many common breast cancer treatments are designed to target. Without them, some of the more targeted options aren't going to work, so doctors rely on other tools instead, most often chemotherapy and increasingly immunotherapy, which helps a person's own immune system recognize and fight the cancer cells. In recent years, treatment for triple negative breast cancer has actually advanced quite a bit. Immunotherapy combined with chemotherapy has become a standard option for many patients, and researchers continue to study new combinations that are improving outcomes. Triple negative breast cancer makes up about 10 to 15% of all breast cancers. It tends to be diagnosed more often in younger women, and it's more common in black women and in people who carry certain inherited gene changes like BRCA1. It's also more likely to be found through symptoms like a new lump rather than through screening alone, and it can sometimes grow a bit faster than other types. This is exactly why regular screening mammograms remain so important. Catching any breast cancer earlier, regardless of its type, generally means more treatment options and better outcomes. I know the word aggressive gets used a lot when people describe triple negative breast cancer online, and I want to gently push back on that framing. Yes, it can behave more assertively than some other types, and yes, doctors take it seriously, but aggressive doesn't mean untreatable. Many people are treated successfully, and research in this specific area has been moving quickly, with new therapies approved in just the last several years. Every case is different. The size of the cancer, how early it's caught, and a person's individual health all matter enormously. This is why your own oncology team looks at your specific pathology report and imaging, not a general label, to build your treatment plan. It's also worth knowing that triple negative status is determined through a biopsy, a small tissue sample taken from the area of concern, which is then sent to a pathologist for these specific marker tests. If you or someone you know has been told a cancer is triple negative, that information came from real lab testing on the actual tumor, not a guess. It's a precise, useful piece of information that helps guide the entire treatment conversation. Here's the practical takeaway I want you to leave with today. If you're going through this yourself or supporting someone who is, try to focus less on the label itself and more on the full picture your medical team gives you: the stage, the size, the specific treatment plan, and how things are responding along the way. Triple negative is a category, not a prognosis on its own. And if you're someone who hasn't been diagnosed with anything, the best thing you can do is stay current with your recommended screening mammograms and pay attention to any new changes in your breasts, reporting them to your doctor rather than waiting. As always, this video is meant to help you understand the terms and concepts you might come across, not to diagnose or direct anyone's individual care. If you have questions about your own results or symptoms, please bring them to your own doctor, who can look at your complete picture. Thanks for spending this time with me. Take care of yourself, and I'll see you in the next video.